You're listening to Heroes of Healthcare, a series about the bold, selfless, and innovative individuals who are serving our communities with compassion and care. This episode is sponsored by Jackson & Coker Locum Tenens. If you are seeking interim physician or advanced practitioner coverage at your facility, or are a practitioner who is looking for more work-life balance, visit them at jacksonandcoker.com to learn more about their services. Now, let's get into the show.
Welcome to the Heroes of Healthcare podcast. I'm your host, Tim Fisher. Today, we are thrilled to have Dr. Natalie Dougé join us. Dr. Dougé has an incredible background and is living a life in service to others. She was one of the participants in the critically acclaimed 2022 Emmy Award-winning National Geographic documentary film, The First Wave. If you haven't seen The First Wave, I think you can get it on Hulu, and it should be something that everybody watches. Dr. Dougé now works as a full-time locum tenens physician and is helping communities all over the country, but this also allows her to cultivate other creative and professional interests. I'm excited to share her story with you, and we're honored to have Dr. Dougé on today's show. Well, welcome to the show, Natalie.
Thank you. Thank you for having me, Tim.
We're honored to have you on Heroes of Healthcare. And let's start with, let's just jump right in. And let's start with, where did you grow up? And let's talk a little bit about your childhood. And eventually I want to talk to you about how you became a physician. But let's start with, where'd you grow up?
Okay, so I am born and raised in the Bronx. Yay, Yankees. I know everyone's going crazy about the Knicks. I know we lost, but it's all right.
They had a good year, though.
They did. I was very happy about that. So I was born and raised in the Bronx. So I am the youngest of two girls, thank God, because I don't know if I could deal with another sibling. I love my sister, though. And I am first generation American. My parents are both from Haiti.
All right.
Yes.
So growing up in the Bronx, I'm sure you did very well in school and you were trying to figure out hey, what do I want to do when I grow up? How'd you pick being a physician?
So in my head, especially growing up first generation American, I think a lot of Haitians only think, there's engineering, there's doctoring, there's financial degrees. But honestly, for me, I always definitely had a knack for science and math, but I just love that medicine in particularly gives me that access to so many different people that I think I wouldn't be able to interact with in other fields. So I'm able to meet some of the most underserved, poorest individuals, but yet in the same aspect, I've met people made of wealth and who've experienced a variety of cultures in the same instance. And I really enjoy talking to people. So that's kind of how I mixed the two together.
Did you have anyone in your family that was a physician or was in healthcare?
No. So I'm the first physician in my family. And now I have a couple of cousins who are nurses. But in terms of my parents' generation, none of them really were in medicine. My dad is a chemical engineer. And then my mom did account billing stuff, but I'm the first. So that was something, yeah.
That's great. So no one in your family was in healthcare. Your parents weren't physicians. At what age did you decide, hey, I think I want to become a physician? I know it's a lot of school, but I want to become a physician.
So I was one of those people who always knew I wanted to be a physician. I knew it was actually going to be a long journey. So I think I knew for sure I wanted to be a doctor, even in high school, because I initially went to Catholic school from first grade to eighth grade. But then in New York City, they have specialized high schools, particularly in the sciences and the arts. And I took an exam to get into Brooklyn Technical High School. So in that school, you actually have majors. And even in high school, I picked biology, having this thought in my head that I really wanted to be a physician. After college, though, I think that's when I started realizing how serious and how extensive the curriculum, the studying, and how much goes into becoming a physician, that I actually took 2 years off After graduating from college, because I already started feeling like, oh my gosh, this is a lot. I did well in college, but I kind of felt a sense of, I also want to enjoy life. I always had that work life, school life balance that I wanted to implement in my life. So I took a 2-year hiatus from schooling, which my parents were not thrilled with initially, because they were like, oh my gosh, are you not going to be a doctor anymore? What does this mean? You're not going to go back. But those 2 years, I think, was the best decision in my life. I did work as a medical assistant for an internal medicine physician who had their own practice. So I still stayed in the medical field while I took a break. So I never steered in terms of me becoming a physician, but the journey and starting to see realistically the sacrifices that need to be done on a personal level, that made me take a break before really diving deep into it for medical school.
I love that. I love that. And I talk to a lot of physicians, and I haven't heard anybody take a couple of years like that. It's like back-to-back gap years, which is kind of cool.
I think now that when I mentor people who are looking into becoming a physician, I kind of recommend taking a break, because once you're in, it's like you're steamrolled into this never-ending pathway where a lot of times there aren't major forks in the road that you can take, particularly depending on what specialty you're trying to get into. So I do tell people medicine is always going to be there, but there's certain aspects of your life, especially like youth, where you can actually explore things that you like, what you don't like, that if you have the ability to take some time off to learn more about yourself before going to medicine, I actually advocate that looking back.
Well, I think it's great. And as you know, I mean, there's so much stress and anxiety in today's world. And the average 18-year-old in America now has the anxiety levels, in the 60s. It would have been, admitted literally. So a lot of times when you're in high school, it's like, what's your major going to be? Where are you going to go to college? And then when you go to college, okay, what's your job going to be? And there's so much pushing you through that once you start, you don't really stop.
Exactly. So my thing is, back in the day, realistically, people's lifespan wasn't living till 80 and about beyond. Like back in the day, people died early, 40s, 50s, but we've advanced a lot. But yet we're still having that mind frame that at 18, 19, 20, where you're not even reached your peak yet, that you need to know what you want to do for the rest of your life, which is like 50 plus years. And I think it's a lot to hold on to for people who technically, I know experiences make you mature, but when you're in school, you're sheltered from a lot of what life may have to offer you, because you're stuck in a building, you're stuck in these rules and these societal norms that come with academia. So I think taking a break to learn more about yourself, you'll never go wrong.
I completely agree. And what's interesting too is you got a perspective into what internal medicine is, it sounds like. So for those 2 years, you got a different perspective of the career that you would eventually go into.
Exactly. So I really wanted to be an obstetric gynecologist because I love women's health. But on the flip side, working in that office, and it was actually a private office, where this particular physician, the way he did it, like your annual physical, the first like 30 minutes, it was a 45-minute long appointment, which is unheard of nowadays. The first 30 minutes was literally just talking, like literally figuring out the person, what they were going through, how their health impacted their day to day. And then the last 15 minutes was like the physical, the plan. And that just spoke volumes, because we're so used to the run of the mill, like patient, patient, patient. But because he had his own practice and was structured a particular way, it really allowed for what I feel is important to truly get a grasp of what people are looking for, and that's quality of life.
Yes, we need more people like you in the world, because I think sometimes as a patient, you do feel like a transaction as opposed to getting to know the individual. And I enjoy getting to know the physician that I have. And a lot of times that does speak to maybe what you're having issues with from a health standpoint, understanding lifestyle and things like that. So I love that. And I bet you learned a lot in those 2 years.
I did. I absolutely did. I learned about myself. I learned about medicine, what it's like to practice, have your own practice, which hopefully one day it'll happen. But I did. And that helped propel me to really solidify my decision of becoming a physician and ultimately an internal medicine physician at that.
So now you've taken a couple years off. You finished your undergrads. How did you pick where you went to med school? And it's not easy to get into med school, so I assume that was a challenge as well.
Yeah. So I graduated for undergrad from Penn State University in State College. So I'm a Nittany Lion.
So is my son.
Yes, Penn State all the way. And when looking at medical schools, don't get me wrong, when you go on a lot of interviews, sometimes things just blend. But I ended up going to Penn State College of Medicine in Hershey, Pennsylvania, because they had something unique at the time where they focused on humanities. They had a whole humanities course where you even had a project when you first started where you worked closely with a patient. So they had a longitudinal course where you get to meet a patient. You're not taking care of them per se, but you're learning about them. You're learning about their chronic medical conditions. And Penn State really did a good job of just not only teaching you the scientific, the pathological components of health and medical diseases, but like how we present in the world and how that looks like. So that's what ultimately made me decide Penn State was the best place for me for medical school. But then I had to bring it on back home to the Bronx for residency. For residency, I ended up going to the Montefiore. So it's the Albert Einstein internal medicine residency with Montefiore Medical Center. And I literally was working at the hospital that I had my own healthcare. So it was so cool to be on the other side of healthcare because I was a patient and now I'm the physician. And working with people of my own community was something that I truly cherished.
That's incredible. And growing up in the Bronx and then going to State College and then going to Hershey, which, by the way, Hershey's a pretty cool town. I love that amusement park.
I do too. And I think it fostered my chocolate addiction. But
yeah, I gained 10 pounds when I get out of the car in Hershey.
It's true. It's true.
Which is not good. And then going back to the Bronx, I mean, that's an incredible journey. And I'm always fascinated how people end up where we are. So thank you for sharing a little bit of your background. So then fast forward, obviously you graduate from residency and you start the process. So was that in the Bronx? Is it like the first opportunity? Was that in the Bronx?
So I ended up working with Northwell Health. It's still in New York City. It's like right on the border of Queens, New York, and Long Island. So, and it was still close to family. I had friends nearby. So I stayed in New York City. And the thing is with medicine and how we're kind of thought, just when I become a doctor or a resident, it'll be great. Oh, just when I finish residency and become an attendant, it'll be great. You just realize the responsibilities and the stressors just come in different forms. So I don't think it gets better. We as individuals get better. And we just hopefully with resources and support from a community that we are able to tap into those skills to deal with a lot of the stressors that come with practicing in medicine. But like I decided to stay simply because I like that whole community, like taking care of the place and the people that took care of me as I was going through that journey.
Yeah, pay it forward a little bit.
Yeah.
So fast forward, speaking of stressors, fast forward to 2020. And I know for our listeners that you were involved in part of the National Geographic documentary, The First Wave. So you were right in the middle of literally the first wave. Can you tell us a little bit about that?
Yes. So I will never forget that time of my life because people don't realize the hospital that I was at was in Queens, New York, and not too far from the International Airport, JFK. So a lot of the patients that we get are from all over. And I remember when the first suspected case of COVID entered the hospital, we were just as clueless as a lot of the population. Of course, we had a little bit more information from like the medical community, but this is something that we've never saw before. And all of us were worried about, are we going to get it? What do we need to protect ourselves? Because we didn't even know initially completely how it was transmitted from one person to another until as more research was done in real time. And then it started off with one patient, but as every week passed by, the volume and the multitude of people being affected by COVID was astronomical. So the way my schedule was is that I work 7 days straight, 12-hour plus days, and then I had 7 days off. I used to dread actually coming back to work because the transformation of the hospital in just 1 week really, at that time, I felt like we are literally in a war zone. Like we literally had to change lobbies into patient care centers where there's beds that used to be the lobby. Every hallway needed to be a place where we potentially need to triage or start initial treatment in patients. It was such a mind-blowing experience.
I bet. I mean, it's hard for me not being there to even imagine that. So, like, what was an average day, the 7 days that you were there for 12 hours? Can you walk us through a little bit of like, what did that look like?
So it actually started for me leaving my apartment because, like I said, I was in New York City. And New York City is the bustling center of the world where there's traffic everywhere you go. My commute was literally like 45 minutes on certain days to literally I can get from my apartment to the hospital now in like 15, 20 minutes because it was empty. Like the streets, no one was out. And I would drive, and then the minute you come in, get ready to gown up. So we had goggles, then we had the mask, we had our gowns, and it gets hot in there. We were sweating, going up and down the stairs. At times, I'm like, is this what asthma feels like? I don't even have asthma. But when you're running around, going back and forth, and I try to connect with my patients as much as possible, but they don't even know what I look like. I didn't even know what some of my colleagues, because we had extra help from locums come in, and I'm like, I don't even know what you guys look like because we were so covered. And in the beginning, the whole issue of not even having enough PPE, the personal protective equipment, that was another dynamic where there was a potential exposure that we didn't have enough. So we were wearing the same mask for multiple days at a time because we weren't sure that we would get enough later on. So that dynamic of trying to help patients, but also trying to make sure you in return are not endangering yourself, it's mentally a tough task to deal with day in and day out. So it's something that I struggled with every day that I had to go to work.
I'm sure. And I mean, that's a time in your life and probably all of our lives that we'll never forget for a lot of different reasons. But, the obvious here, I just want to thank you for what you did during that time. You were right in the middle of it. And when you grew up in the Bronx, you probably didn't think you would be part of a Emmy award-winning National Geographic documentary showing the world, really, as you said, you were right in the middle of the storm.
And what I want people to know is that when I first found out that they would have a director or cameras come into the hospital, I literally thought it was going to be a 1 day, 2 day thing where they would finally be able to show the outside world to me, because in the hospital, it could be its own twilight zone, what truly was happening. Because there was a lot of misinformation at the time in terms of what healthcare professionals were experiencing in the hospital. People didn't know just how people were dying, how they were presenting, how strained the healthcare system was at the time. We had politicians, we had other people talking, but no one at that time of filming, which was like in March 2020, did they have someone like myself who is a minority, a Black female, who both outside in the outside world as a minority, but also in medicine. There's not so many Black female physicians, and hearing our voice, and I wanted to be a voice for the rest of my colleagues about what we were experiencing and that we too needed help from the public to do what they could to help us help them in terms of prevention and figuring out ways to stop the spread. So that was my initial reason why I did this film that I didn't even know was going to be a film, to be honest with you. I thought it was like a news special.
You were a little busy at the time.
Yeah, like to me, most of the time it was like running, like I forgot the cameras were there. They would have to like chase after me. So like it wasn't something that I knew it was going to become this whole big ordeal, but I'm actually so glad. And a part I am indebted forever to Matt Heineman, who's the director, as well as their producers and also the fellow participants, because they saved me in a way that I didn't know I needed to be saved in terms of that reflection back on that time, because I was on autopilot. And I think I may have stayed in that autopilot if I didn't have a chance to just stop and then actually get a real mirror, literally through a camera lens, of just how much I've changed, or I did change in that time frame. So it was an experience.
I bet. So, I mean, the emotional, the mental toll that takes on you from going 7 days in a row. And, a lot of physicians right now are experiencing stress, burnout, and, struggling with their balance in their life, the well-being, whatever terms you want to use. And reflecting back on your time in the middle of the storm, can you share like how you look back and how did you keep yourself well through that process?
So to be honest with you, reflecting back, I was not well in real time where I was working during the pandemic. Thought I was, because I put the focus on my responsibility as a physician. I put the focus on my patients needed me more than anything. I put the focus on everyone but myself, which a lot of us do in real time. Looking back and through, like I said, the film, and now that I'm a locum tenens doctor, I have now incorporated the need for reflection during stressful times to really kind of assess my own well-being. Am I really okay? Because it's amazing how when everything settles and you sit in silence, what emotions can truly come up. And a lot of us don't have the luxury of silence or the luxury to slow down. So I think because I was not well when it was all said and done. I think I was managing. I think, like I said, I was just putting the focus on other things that I thought were more of a priority than myself. And the people around me invited a safe space for me to like, no, it's okay to not be okay and slow down. You do need to stop for a second. The world will still turn if you stop for a second. So I think reflection is important in all that we do. And I think now I'm in a much better space. I think now my well-being, because I realize no matter what my priorities are, I do have to put myself as top priority. And it's not such a selfish thing at the end of the day, because when I'm at my best, I can be my best for others. So that's something that I've learned because of the pandemic.
Well, I would encourage our listeners to go. I think it's on Hulu and now, but The First Wave, National Geographic documentary, and it's very real. And I think it did shine a light on something that we need to be aware of. And caring for our caregivers, and there are so many of our caregivers who are others focused that sometimes they don't take care of themselves. And ultimately, that is not good. And I know that you are involved on the Dr. Lorna Breen Heroes Foundation board, and that's something that's making an incredible difference in the United States. Can you share a little bit about that?
Yes, absolutely. So for those of our listeners who may not know, The Dr. Lorna Breen Heroes Foundation was co-founded by Corey Feist, who you had on your show previously, who unfortunately is the brother-in-law of Dr. Lorna Breen, who died by suicide in April 2020 after contracting COVID-19 and was suffering from the stressors of her job and the thought of losing her license because of mental health issues that she had, as well as so many of us have. And through her tragic loss, though, Corey Feist and her sister, Jennifer Feist, created this foundation that focuses and spotlights the well-being of us healthcare professionals and to bring awareness to reduce the stigma that may be associated with dealing with a number of mental health disorders, whether it's anxiety, depression, a number of things. And through their efforts and through the board and through the advocates and supporters of the foundation, we helped pass the first ever legislation, the Dr. Lorna Breen Act, where there's now funding involved to healthcare industries and systems to have policies in place and programs to reduce healthcare professional burnout and to really focus on our well-being so we don't have to leave this profession that so many of us strive or all our lives wanted to be a part of, but feel like we no longer can actually participate in it because it's a detriment to our own health. So the foundation is just doing such a great job in just spreading the word that it's not just healthcare professionals that need to take on this burden of well-being and the self-care, but it's the whole healthcare system and the industries involved in healthcare that need to make significant change to help support us so that we do have that sense of we do matter and that the care that we are giving is both reciprocated back to us.
Yes, amen to that. And a key point here is it's not just during COVID. It continues to be a problem around our country. And we need to care for our caregivers, as I said earlier, because it's not something that was just 100% COVID related. Of course, COVID accelerated it in some cases, but in many cases, people were, or physicians and healthcare workers were struggling with their well-being before COVID.
Absolutely. I believe I was one of those physicians. So the running joke when I was working full time as an employee, I used to say, being a doctor is my side hustle. I just haven't found my main hustle because the stress that's the day to day of being a physician, I said, I don't know how long I can keep this up. So it really did not start or end with the COVID-19 pandemic. A lot of us are working very long hours with a patient load that is not sustainable. A lot of us are dealing with the ramifications of moral injury, where we're practicing in a way that may not be aligned with how we see healthcare being delivered, but yet we're participating in this system that we have because we don't have an alternative yet that can be very hard to deal with.
You made a decision at some point in your career to start doing locum tenens. And from talking to you, you have a heart to serve in areas maybe where they don't have access to a physician of your caliber, like in New York. Can you share a little bit about what you've seen and experienced with locum tenens and maybe how that helps you with staying well yourself?
I honestly didn't know about locum tenens until COVID-19, the pandemic, when my hospital that I worked at finally hired a locum tenens physician. Okay. And when I found out about this opportunity where you are able to go to different hospital sites or different clinics or other sites that need medical providers, I was said, what? No way. And you can kind of dictate your schedule. What? No way. And the pay maybe substantially more than what I'm getting as an employee. I said, wait, no way. So I said, especially after pandemic, I was completely burnt out. I needed a break and I needed more flexibility in my life. And I honestly said, I want something completely different from New York City. I want to run away. And my first gig, I went to Montana, Helena, Montana.
All right.
This Bronx girl went to Helena, Montana. And that was the best decision I ever made in terms of opening my perspective of what healthcare looks like in terms of underserved. I only knew what underserved looked like in a city setting. And people don't realize most of the United States is actually small towns, rural places where they don't have the luxury that's in New York City, where there's hospital 2 blocks from each other or there's multiple hospitals. So for me to see that in Montana, there's this one hospital where the next one is maybe an hour and a half, 2 hours away or plus, opened my eyes into what access of care really looks like for a lot of Americans. So I think it also allowed me to be able to spread my reach and my way of caring for people in so many different ways. And I learned so much from my patients and from colleagues. And I think it's the best decision ever for people, one, trying to figure out what's the best place you want to work in. Because some people think, oh, yeah, I'm a city girl, I'm a city girl. Maybe you're not. Maybe you like having a job where there's windows in the hospital facility that has a beautiful scenery, like something simple like that, to figuring out that the work balance is different at other facilities than what you may be used to. So I highly encourage people as a means of exploration, both of how healthcare is practiced in the United States, as well as exploration of self in terms of, wait a minute, I actually like this working environment. Because there are a lot of people who do locums that ended up working at a site that they worked as a locum. So I think it's a great way to expand your reach in terms of who you can care for, as well as where you ultimately want to be.
Well, it seems to be a fascinating way, too, to see a microcosm of our country. As you said, where we grow up, we think that's normal. And then you go somewhere else and you connect with people in a different way in different environments. And it sounds like, I mean, you've probably gone to towns around America that you probably didn't know where they were on the map. And you've connected with people and probably built relationships.
Exactly. And I'm such a people person. I thrive and it fills my cup. And some of the stuff that we see on TV will have you thinking that I don't belong in one particular area, or I won't fit in this particular space, or because of XYZ. But being a locum tenens physician has showed me a lot of us are more similar than what we think. You can connect with people from two extremes. Like I said, I'm a Bronx girl from New York City, and I have made such connections with both physicians and patients in some of the most rural, like farmers, like in all different backgrounds, both like myself and like backgrounds that I would never even know before going to that area. So if you really want to connect with people and learn more about what this country has to offer and what it lacks, I think doing locum tenens and traveling within the US is such an asset, both of how I deliver care and how to connect with people even outside of my profession.
Well, your experience and your background is just incredible. I mean, we've talked about a lot in 30 minutes here, you know, growing up in the Bronx and taking a couple of years before you went to med school, and then, you know, being on the first wave, being part of an Emmy award-winning documentary, doing locum tenens in, you know, towns all over America that you weren't even sure where they were. It's a fascinating background.
And one that I never expected, to be honest with you. I will never forget, one of my medical school interviewers once asked me, describe yourself in a 4-letter word. And then they walked out the room and said, I'll be back and you need to have your answer by then. And I'm like, this is what they asked for medical school? What? I'm like sweating all over my armpits. And then I don't know how this came into my mind, but the word I ended up picking was open. And to me, that meant I am open to new experiences. I am open to learn. There's a sense of humility that comes with being receptive to your surroundings and knowing that there's much more than what you think. So I have carried that with me, and it's been enabling me this far to have such experiences like being in an Emmy Award winning film, being able to speak with you on a podcast. I never thought that was going to happen, as well as still being a part of a profession that I truly do love. And I truly want to be able to stick it out and practice medicine for as long as I can. So it's crazy what experiences that I have thus far. I'm ready for what's next. But yeah, I tell people, just be open. You will surprise yourself and others of what can happen in your life.
Well, being open is great. As I was doing research on you for this podcast, seeing you walking the red carpet with the show, and seeing the clip on Good Morning America where Lionel Richie surprised you.
That was so crazy.
I mean, come on.
Like, I was so floored. OMG. And like I said, I did not expect any of this. And to this day, I'm still like, oh my gosh, Lionel Richie, I'm just such a fan. and the thing is, I just want anyone who knows me and who may ever interact with me, I just try to be as genuine as I am. There's only one of me, and I really try to my best. I really try wholeheartedly to care for others and truly be non-judgmental about, because everyone has their flaws, everyone has their strengths, and that's what makes us us. So I just really love connecting with individuals. Medicine helps me do that. If I can help someone have a better quality of life, that's a bonus to me. So I love what I do. I love locum tenens. I don't think I will ever be an employee ever again. I really don't think so. But I think I'm very blessed and fortunate just to have this array of experiences thus far.
Well, you are incredibly genuine and real. And, we're honored to have you on the show. And I think you're showing people, well, I mean, first of all, we need more physicians like you in the world. Obviously, we don't have enough physicians in our country. But more importantly, we need more people like you in the world who are genuine, authentic, and real, and have a heart to serve others. And your life has been that. You're an example of that.
Thank you so much for the kind words. Those are the things that actually help keep me going when I'm having those bad days. I'm not always happy-go-lucky. I do have those days where I question or doubt my own abilities. And just hearing those words of, at the end of the day, you're trying to do something good. You're trying to leave your mark on the world or on someone else, that they are cared for, they are loved. And that's literally what inspires me to keep going. And I thank you so much, like I said, for those kind words and this opportunity to speak with you.
Well, thank you. And we ask all our guests on this show one final question. So who is your hero?
Okay. I'm not going to lie. I have an Avengers team of heroes in my life. Okay. They have saved me from me countless of times, but it's hard for me to choose. I know this might sound crazy, but it's actually my rescue dog, Mars.
All right.
I know I'm like, Mom, I love you. My sister, I love you. My best friend and my boyfriend, I love you all. But I say my dog because for the first time, especially, he was with me through COVID. There was a time where I couldn't really talk about my experiences in the hospital because I didn't want to further scare my family, worry about me while I'm going at work. And that love for my dog was what I needed at times. And then he actually started me with my love for walking. Before my dog, I was never a walker, but now you have no choice to go walking. And through my walking, it's when I do the most reflecting. It allowed me to become more physically active. And it really was the medicine that I needed, both during the pandemic and even now. So I love my dog, but I love my people friends too. But for now, I think one of my heroes is definitely, he saved me one of the darkest times of my life. And that was during the pandemic.
Well, that makes perfect sense to me. I've always told my wife that dogs are unconditional love.
Yeah.
You have the worst day in the world and you come home and they're wagging their tails. So
it's true.
And they're just loving on you.
I'm learning from my dog what unconditional love really means. I am. And I'm trying to instill that and portray that to people I come in contact with.
Well, you do that. And we are honored to have you on the show. And thank you so much for taking time to join us.
Thank you so much, Tim.
You've been listening to Heroes of Healthcare. If you enjoyed today's episode, please tell a friend or leave us a review wherever you get your podcasts. You can also visit us at www.heroesofhealthcarepodcast.com for more information or to listen to past episodes. Thanks again to our sponsor, Jackson & Coker Locum Tenens, providing interim physicians and advanced practice staff for over 40 years.